Okay, moving on. So this is our risk assessment that I created to kind of go over. It can be included in any kind of dental software, or it can be done on paper. It can be done verbally, anything like that. It can be part of the patient's medical history that they fill out in advance when they come to the office. This does not necessarily have to be filled out at every appointment. This would be something that would be great to be included in new patient paperwork. So something kind of as a baseline to have the patient fill out and then keep on record. So this is the high blood pressure and periodontal risk assessment. So this is created hand in hand because they do coincide, and we know high blood pressure has effect on the periodontium, and the periodontium has effect on high blood pressure when periodontal pathogens are involved. So simple yes and no questions to start out here. Looking at age. Age 65 plus has been shown to be at greater risk for blood pressure issues, cardiovascular issues, as well as periodontal issues. So you would mark yes or no on that, or the patient can mark yes or no. Signs of active periodontal disease upon periodontal assessment. This will have to be filled out by the dental provider, yes or no, based on what your findings are. History of past periodontal disease. This can be filled out by the patient or the provider, but the provider should be checking this to make sure that the patient filled it out correctly, and make sure that they agree with that. High blood pressure reading. So if your patient has a high blood pressure reading and they are not medicated, that'd be active hypertension unmedicated, yes or no. High blood pressure reading, but actively medicated, yes or no. So this kind of can tell us a little bit about our patient and about their history, their medical history, whether or not they're being treated for hypertension or not. Use of any tobacco products, yes or no. Overweight or nutritional deficiency, yes or no. Stress, yes or no. This can affect both the periodontium as well as high blood pressure. Genetics, so any family members, mom or dad, who have a history of high blood pressure, have a history of periodontal disease, yes or no. Does the patient take 2 or more cardiovascular medications? If the patient's on 2 or more cardiovascular medications, this increases their risk. So that'd be a yes or no again. And then we could formulate a diagnosis based on this. So a dental hygiene diagnosis or a diagnosis by the dentist on what our outcome was. So essentially 1 or more yes in this category indicates a risk. Now, 1 yes versus 5 yeses is going to be less of a risk, hopefully, but that's not always the case. So if we have any of these risk factors, it by no means that means the patient's going to have periodontal disease in the future or have high blood pressure. It is just putting it on our radar that the patient may have some risks, and we may want to keep a closer eye on that. So then you can have your recommended dental hygiene intervention. Clinically, what am I going to do based on this risk? Am I going to change anything about my treatment? Am I going to recommend anything to the patient based on my treatment? That's where you could put that. And then patient education. So able to jot down or just kind of remind yourself of what you want to remind the patient about, what you want to educate the patient on based on their risks. And then the bottom half of this is referrals needed. So based on the outcome of this risk assessment, as well as other tools you're using, you can determine whether a medical consult with a physician may be indicated. If it is indicated, we're going to check yes, and then we're going to fill the rest out. Essentially, the rest is just any information that may be pertinent to the physician or to our records. Moving on, I want to talk about the tracking form now. So this is a very simple form. This can be integrated into a software, or it can be on the laminating sheet and something that you fill out and put in your notes later. Just something to keep track of appointments and when they were, how far apart they were, and what blood pressure readings were received. So this could easily be in the patient's record, whether paper or electronic. Next up is the medical consult form. The medical consult form is exactly what it sounds like. It is a form that can be filled out and either faxed, emailed, sent in person to the physician that you are referring to. So this case would be if your patient came in, was hypertensive, stage 1, stage 2, or even upper level stage 2. So for sure, for upper level stage 2, you would be filling out this medical consult. It is highly recommended that you still fill this out if your patient's blood pressure is hypertensive stage 1 or 2. Just because you aren't deferring treatment, if we recall back to the guidelines, you're not deferring treatment because they're hypertensive stage 1 or stage 2, but you're still recognizing and documenting that the patient has hypertension. So especially if the patient is undiagnosed or has not been to their physician in a very long time, that would indicate that we need to fill out a medical consult form. Even though we're able to still see the patient, we kind of want to get ahead of it. So make sure the patient knows and is aware of this and kind of have that discussion with them and fill this out at some point in your appointment and have it faxed over or emailed, so forth, to the physician. Your patient may have a physician or a cardiologist, or they may not. So be ready to maybe have a list or someone or a physician or a cardiologist or a hospital to recommend the patient receive care from for those patients who do not have a physician. So the medical consult form is simply just a little fill in the blank and pretty self-explanatory, but it's just blank. The name of the patient has been referred to his or her physician for a hypertensive medical consult. This patient was seen in our office for dental care, and the patient's blood pressure readings were. And this is where documentation is very important. You want your patient to have these, and I will show you that in the patient materials as well, where you're going to allow the patient to have their readings. And then you're also going to make sure that they're documented in your software or in your note taking. And then you're going to want to document it here on your medical consult form for the physician to have. And then it carries on. It says this patient reports a medical history of hypertension. Check yes or no. So this would be if your patient, if you know your patient is already diagnosed with it or not. And this patient reports taking the following medications. So you would input their medications here that they have provided to you. We believe this patient is at risk for a hypertensive episode and may need treatment for hypertension. So just because the patient is already diagnosed with hypertension or already taking hypertensive medication, if their blood pressure is still high or uncontrolled, they need to go back to their physician. They need to figure out why this medication isn't working or what's going on. Oftentimes, patients require more than one hypertensive medication to manage their hypertension, or oftentimes the medication stops working for them after some time, and they need to change their medication in order to get the same results. So just because they are diagnosed and taking hypertension medication does not mean it is not a problem still. So moving on, it says this patient's periodontal status is, because we want to start collaborating with their physician. We want to have that relationship with their physician, for their physician to understand that, one, we take their job seriously when it comes to their patients and taking care of their patients. And when we recognize a problem, we are going to refer back to them. And we want them to do the same. We want them to recognize that the oral cavity affects this patient. The oral cavity affects their patients. The oral cavity affects everyone. And if it's in a negative state and we have periodontal disease or something going on, it can help explain some of the issues, especially cardiovascular. So we just want to start making that connection and letting the physician know that we are noticing something, and if they notice something, to let us know. So we are going to let them know if the patient has poor periodontal health and we think this may be a concern and maybe affecting their blood pressure, or if it's excellent and that's not a concern. And we're unsure why they're having hypertension from a dental perspective, but we're referring to them anyways. So then at the end of this form, it says we have educated the patient on their current blood pressure readings and the oral systemic link. The patient has been informed that a consult with their physician is recommended. That's just kind of an ending statement there. let's go ahead and move on to the final form and document here. It is patient materials. So this is the patient materials that should be prepped in your office, ready to go and ready to hand to a patient. One, if they are hypertension stage 1 or stage 2, but especially and specifically for those patients that we are going to have to defer treatment. So this is for them primarily to take home because it is talking about their appointment that had to be deferred and kind of what needs to happen in the meantime. So the letter reads, "Dear valued patient, we understand it can be a great inconvenience to have to reschedule your dental visit. We want you to know that we treat the whole patient and we care about your overall health. There is a link between bacteria in the oral cavity and your heart, and this is why we address blood pressure in dentistry. High blood pressure can be life-threatening, and we would like to work with you and your physician to make sure you live a long, healthy life. High blood pressure is treatable and manageable. By controlling your high blood pressure, your oral cavity will improve and the opposite will occur as well. Better brushing, flossing, and more frequent dental hygiene cleanings will have a positive effect on your heart and blood pressure. Today," and then fill in the blanks here, the patient's name in our office was today, blank in our office took your blood pressure and your blood pressure readings are. Excuse me. So that line is for the provider. So whether it's a dental hygienist, an assistant, whomever took the blood pressure reading, we like to put their name there. That way, if the patient calls back and he wants to talk to that person, they have their name. And then it says your blood pressure readings are, and so we again want to document here, it is the patient's blood pressure readings and they need to have them to take home so they know what their blood pressure was that day. A copy of the American Heart Association blood pressure standards is included in this packet for your reference. Their website is full of important information on high blood pressure. A medical consultation form has been completed and will be faxed to your physician. If you do not have a physician you see regularly, a physician can be recommended by our staff. So this just kind of takes what the provider should be going over in the appointment with this patient. It takes it and it puts it just in layman's terms. It puts it in a letter for them to take home in case they have any questions. They can reference this letter because patients oftentimes aren't hearing us when we're talking to them in the dental office, and it's not any fault of their own. It's just that they're overwhelmed, they're having a hard time listening. So by giving them this to take home, when they get home and have a minute to sit down, they can pull this out and they can read and they can see the reasoning behind why we had to defer treatment. I think this is so important for the patient, for their understanding and everything like that, and for their own records of knowing what their blood pressure was that day and who their provider was and what's going to happen, essentially. And then attached to this letter, there would be a link or a QR code to the American Heart Association's website where they can read all about the blood pressure guidelines, and they can see exactly where their blood pressure fell into. They can see, yep, I was hypertensive, upper level stage 2. And then they can read about the seriousness of it, and they can get some really wonderful resources from that website. So that is all I have. These are the forms. These are the materials that when utilized properly in a dental office, they will just help providers to help patients essentially, and to not forget about the patient's overall health and to not treat the patient just as the oral cavity, but instead treat the patient as a whole. And it'll help with protocols, documentation, things like that if these are implemented. So again, these are all items that can be implemented into your routine dental care, new patient records, things like that. And they are absolutely for the dental provider to use at their discretion. And some of these may fit your dental office perfectly, and you may love them, and others may not fit into your dental office just right, or you may already have other resources that you use similar. So I would just love for you to use these forms where you need them and how you need them, and to train your staff and providers on hypertension in the dental office. Thank you for listening.